This video will demonstrate the technique for fabricating an anterior deprogrammer both directly in the mouth and indirectly in the lab. For this technique, we will be using the Ministar thermal forming machine. The Ministar segment of the technique is the same for both procedures. Prepare the model by defining the anatomical contours with a lab knife and fill voids with a quick setting stone. Block out moderate undercuts using Model Block, Great Lakes Compound 101, or a light cure gel. Isofolin can be used in place of a separating medium to provide just enough relief to alleviate the discomfort of a tight-fitting splint. Place a sheet of the isofolin spacer material on the pressure chamber and secure it with the clamping frame. Position the model in the pellets so that the gingival margins are level with the rim of the cup. Overfill the cup with pellets. Remove pellets with a brush bridging straight over from the edge of the cup to the gingival margin. Make sure there are no pellets on the rim of the cup. Enter the heating time of 25 seconds into the Ministar or Biostar and swing the heating element over the pressure chamber to initiate the heating cycle. Once the heating cycle is complete, remove the heating element and swing the chamber over the model. Lock the chamber in place by turning the locking handle toward the front of the machine to activate the pressure and the cooling cycle. At the end of the cooling phase, evacuate the air pressure from the chamber and unlock the chamber by turning the locking handle toward the back of the machine. Slide the clamping frame to the left to release the material and swing the chamber back to its open position. Lift the formed isofolin from the model with the clamping frame. Trim the excess material at the pellet junction. Place the isofolin spacer back on the model. Typically, a piece of 1.5 millimeter splint biacryl material is used to fabricate an anterior deprogrammer. Remove the protective coating from both sides of the material. Place the material on the pressure chamber and secure it with the clamping frame. Enter the heating time of 50 seconds into the Ministar or Biostar and swing the heating element over the pressure chamber to initiate the heating cycle. Once the heating cycle is complete, remove the heating element and swing the chamber over the model. Lock the chamber in place by turning the locking handle toward the front of the machine to activate the pressure and the cooling cycle. At the end of the cooling phase, evacuate the air pressure from the chamber and unlock the chamber by turning the locking handle toward the back of the machine. Slide the clamping frame to the left to release the material and swing the chamber back to its open position. Remove the matrix from the machine and shake off the excess pellets. Do not remove the model from the matrix. Trim the excess material away at the gingival margin. With a lab knife, remove the splint biacryl from the model. Peel away and discard the isofolin spacer. Using the model, place a trim line halfway down the labial surface of the anterior teeth and at the gingival margin of the labial surface of the posterior teeth. Place the trim line at the gingival margin of the lingual side. With a carbide taper burr in a lab handpiece, trim the biacryl to the reference lines. Place the matrix back on the model and check the reference lines. Repeat the trimming procedure until the desired height is achieved. Finish the edges with a Dymo Pro wheel in a lab handpiece. The Dymo wheel will eliminate any excess flash and leave a smooth edge. For the direct technique, try the biacryl matrix on the patient to make sure it's comfortable. With 50 micron aluminum oxide, air abrade the anterior section from the first premolar to the first premolar where the bite plane will be formed. Apply a light cure bonding agent to the anterior section. Place in the ProCure oven and cure it according to the instructions for the bonding agent. Light cure rope material is used to form the bite plane. With fingers, mold the light cure material to the basic flat plane form from first premolar to first premolar. Make sure there is enough material so that the lower 6 anterior teeth make contact. The bonding agent can be used to smooth the bite plane to reduce trimming time. Prepare a whale tail with a thin layer of petroleum jelly. This will be used to form the flat plane. Place the appliance into the patient's mouth and slide the whale tail across the bite plane. Ask the patient to close very lightly into the bite plane so that the lower 6 anterior teeth just come in contact with the bite plane. Use a light cure gun to begin to cure the bite plane. The light cure gun will not cure it fully, but will keep it from distorting. Finish curing the bite plane in the ProCure oven. With a pencil, mark where the lower anteriors made contact with the bite plane. The goal is to trim the bite plane as flat as possible. The position of the burr creates the angle of the bite plane. Using a carbide taper burr and a handpiece, hold the handpiece in a way that allows the flattest plane possible. Starting in the premolar region, trim the bite plane down just to the point where the pencil marks are eliminated. Insert the appliance in the patient's mouth. Use blue or black articulating paper to check the contacts. With the articulating paper between the lower teeth and the appliance, ask the patient to tap several times to mark the contacts. Check the contacts in the left and right posterior segments as well. Remove the appliance and check the contacts to confirm that all the anterior teeth are hitting the flat plane of the appliance. If all anterior teeth are not contacting the bite plane, lightly trim marks and repeat the process until all anterior teeth are in contact. Remove any posterior interferences to ensure that there is no posterior contact when the anterior teeth are touching the flat plane. Once all the anterior contacts are visible, choose a different color articulating paper to mark excursive movements. With the articulating paper between the lower anterior teeth and the appliance, ask the patient to slide left and back, then right and back, then forward and back. Repeat the process for both the left and right posterior segments. After excursive movements are marked, use the black or blue articulating paper to mark the centric contacts. Remove the appliance. Check to ensure contact of the centrals and laterals on the bite plane in the protrusive movement. There should be clean lines on the canines for both left and right excursive movements. Make sure there are no contacts in the posterior during excursive movement. With this patient, we have a lower central incisor significantly below the occlusal plane, so we would not expect to have contact on the bite plane. Notice there is still cuspid contact in the protrusive movement that will need to be trimmed away. We're only looking for cuspid contact in the excursive movements. As you can see, we have maintained centric contacts and also have desired contacts in both protrusive and excursive movements. At this point, we're ready to continue trimming and finishing the appliance. We will present the indirect method for fabricating an anterior deprogrammer using a set of mounted models on a SAM3 articulator. Open the incisal pin on the articulator to 5 mm to accommodate the thickness of the anterior deprogrammer. Remove enough pellets to submerge the mounted model as deep as possible into the pellet cup with the heel of the model facing the material. Build up with pellets towards the gingival margin and cover the palate with pellets as well. Remove pellets from the rim of the cup. Form and trim the isofolin spacer layer as previously shown and place the spacer back on the model. Form a piece of the 1.5 mm splint biacryl as previously shown. At the end of the cooling cycle, remove the model with the formed biacryl and remove excess pellets from the plastic. Without removing the material from the model, cut out template along the pellet model reference using a 3/4 inch lightning disc with a standard mandrel and a lab handpiece. Place mounted model back onto the articulator and check for posterior interferences with articulating paper. Remove any interferences with a carbide burr and a lab handpiece. air abrade the anterior section from first premolar to first premolar where the bite plane will be formed. On the lower model, place blockout material on the labial and lingual surfaces of the anterior teeth just below the incisal edge. This will prevent the cold cure acrylic from slumping over the lower anterior teeth. Apply separating medium to the anterior segment of the lower model. Apply a small amount of the monomer to the anterior segment of the biacryl on the upper model. We will use Great Lakes Biacryl Ice to build the anterior bite plane. Measure 10 cc's of polymer and 5 cc's of monomer. In a Resimix cup, add monomer and slowly add polymer. Mix thoroughly with a spatula. Remove crystallized resin from the rim of the cup. The resin should be a dough-like consistency. Remove resin with a spatula. Add a few drops of monomer and finger form it into a rope. Form it onto the biacryl to cover the 6 anterior teeth. Place the upper member of the articulator onto the lower member and with centric hubs locked, index the lower anterior teeth into the resin. Use a little monomer on your finger to continue to shape the bite plane. To ensure a clear, hard appliance, place the articulator into a heated pressure pot for 15 minutes. The pressure pot temperature should be approximately 120 degrees Fahrenheit and the pressure regulated to 20 psi. At the end of the curing cycle, release the pressure from the pot and remove the articulator. Remove the upper member of the articulator by releasing the locking hubs. With a pencil, mark where the lower anteriors made contact with the bite plane. Using the same procedure as previously outlined, trim the bite plane as flat as possible just to the point where the marks are eliminated. Place the upper member of the articulator onto the lower member and with centric hubs locked, use blue or black articulating paper to mark the anterior contacts. Once all the anterior contacts are visible, choose a different color articulating paper to mark excursive movements. Release the centric locks. Insert red articulating paper and move the upper member left, right, and forward to mark the excursive contacts. Remove the upper member and check the contacts. Eliminate the marks until all the anterior teeth are in contact during excursive movements. Repeat this process until there is contact of the centrals and laterals on the bite plane in the protrusive movement. There should be clean lines on the canines for both the left and right excursive movements. Make sure there is no contact in the posterior during excursive movements. Using a 3/4 inch lightning disc and a lab handpiece, trim halfway down the labial surface from first premolar to first premolar. With a lab knife, gently remove the appliance from the model. Discard the isofolin spacer. The following trimming and finishing procedures are the same for both the direct and indirect techniques. With a carbide taper burr and a lab handpiece, trim the appliance halfway down the labial surface of the anterior teeth and at the gingival margin of the labial and lingual surfaces of the posterior teeth. Finish the edges with a Dymo Pro wheel and a lab handpiece. The Dymo wheel will eliminate any excess flash and leave a smooth edge. Use a micro etcher or sandpaper in a sandpaper mandrel to smooth trimmed surfaces. Apply a thin layer of Palaseal to the outside surface of the appliance. Place the appliance on the model and cure it in the ProCure oven for 1 minute. Smooth acrylic using a medium grade pumice with a wet rag wheel on a low speed lathe. Do not over pumice as this could alter the contacts. Apply Tripoli polish with a 4-inch loose muslin buff on a low-speed lathe. Finish the acrylic using Fabuluster polish on a separate 4-inch loose muslin buff on low speed. Clean the appliance with liquid dish soap and soft brush. The appliances are now finished. For the direct technique, place the appliance back in the patient's mouth and recheck centric contacts and the excursive movements. For the indirect technique, place the splint back onto the mounted model. On the articulator, recheck centric contacts and the excursive movements.